Other types of upper tract disease, apart from urinary stone disease, that an endourologist would be involved in are conditions that usually cause obstruction to the drainage of urine from the kidney. The classic one is idiopathic pelviureteric junction obstruction, which sounds dramatic, or PUJ obstruction, which is a condition where the join between the pelvis, which is the main part of the kidney drainage, and the ureter, the narrow tube, is obstructed. Patients present commonly with a lot of pain in the back, which can be exacerbated by alcohol or a high fluid intake. The pain can be quite awful and then usually settles within 24 hours. This needs to be managed quite appropriately initially with investigation to establish the diagnosis, and quite often patients will require surgery for that area of the kidney to be cut out and reconfigured, what we call a pyeloplasty. The other types of obstruction that we deal with are conditions that cause narrowing of the pipe of the ureter, the so-called ureteric stricture. Unfortunately, the commonest cause for this is from malignancy, from metastatic disease, such as the colon, or from carcinoma of the breast, or from prostate cancer and bladder cancer and any disease in the pelvis. And this is managed with internal stenting, which is like using an internal scaffold within the ureter to resist the blockage from the outside and allow the kidney to drain appropriately into the bladder. And these patients are managed with various types of ureteric stents, which offer significant relief of obstruction, but unfortunately can often be associated with bladder symptoms from the bottom end of the stent. The other cause for ureteric strictures are benign disease, a condition known as idiopathic retroperitoneal fibrosis, which is rare. Endometriosis in women, which is very topical at the moment, can unluckily cause obstruction to the ureter in the pelvis, and of course any operation in the pelvis risks the ureter and can lead to ureteric strictures. We then often get involved to relieve the obstruction and put a stent in, and usually these patients require reconstructive surgery to cure them of the stricture in the long term.